The Hopkinton Women's Club hosted their monthly speaker series event. This month, Hopkinton Family and Youth Services was featured and talked about some of the services they provide.
Where we are today. Our resource center was built by our resource counselor, making resources accessible and easy to find. New marketing through social media like Facebook, Instagram, and a created newsletter started to let people know more about us, who we are, what we do, why we do what we do. 2 prevention grants, added 2 full-time staff to the department to work locally and regionally in the prevention of youth substance use. Erin is with us through that grant. And we secured the Mental Health Awareness Training Grant through September 2026 to increase community awareness of behavioral health issues, of HYFS's mission and services, and how to access help.
So we have representatives from the business community, we have young people at the table, we have parents, we have religious leaders in the community, we have media. HCAM is part of the coalition, police, fire, civic groups. We have representatives from the healthcare community. The schools are at the table, public health department, as well as the YMCA. And so what do? The coalition together works to reduce substance use. So by combining our resources, coordinating our efforts, we can have a greater impact within the community. Here you can see that since 2014, which is the dark green, and then 2023, which is the last time that the survey was given, in terms of the various substances, use has decreased over time. We can't take credit for the total decline. Over those 10 years, the population has changed, as well as larger public health policies have been implemented, particularly around electronic vapor products, in terms of restricting access for youth. But we are measuring and looking at where we can implement various activities in the community to lower substance use.
Then the Mental Health Collaborative offers through the grant training for parents and caregivers. And I look at caregivers also as people who maybe aren't parenting anymore, but maybe have, special nieces and nephews or grandchildren, or maybe like neighborhood kids that they're really fond of, or other adults that, that could use mental health literacy. So it takes QPR and goes a little bit different direction. The concepts of QPR, more about like, what is mental health? What is wellness? How is stress different from anxiety? What language do we use when we talk about mental health? And then how to get somebody help, or how to get help for oneself, and what the different types of mental illnesses are versus when we're just having poor mental health and it's not necessarily a diagnosis. So it kind of breaks apart all that stuff. And that's through the Mental Health Collaborative, which is a nonprofit in the community some of you are aware of. They do those trainings through a grant for us. We pay them to come on in and do those trainings. In the year ahead with our MHAT grant, we want it to be sustainable. So we will get trained in that model and be delivering those independently as well.
You can view the entirety of the speaker series event at our YouTube page, youtube.com/HCAMTV.